According to the National HIV Prevention Roadmap of 2018-2030, Uganda has made great strides in reducing the overall HIV incidence. Recent statistics from the Ministry of Health indicate that AIDS-related mortality has steadily declined over the past 10 years. The Uganda Population-Based Impact Assessment report also indicates that the country has made significant progress in reducing the HIV prevalence from 7.3% in 2011 to 6.2% in 2017 among adults aged 15 to 64 years, but that prevalence remains high among females at 7.16% than males at 4.7%.
A significant proportion of the new HIV infections are occurring amongst this population group. So we have to prioritize them. We have to look at how to reach them and the conventional methods that we've previously used in delivering both services.
Statistics from Uganda AIDS Commission indicate that there are 1.3 million Ugandans living with HIV, of which 67% are on treatment and 60% are virally suppressed. 74% of Ugandans know their HIV positive status, while 95% of mothers living with HIV are accessing elimination of mother-to-child transmission of HIV, EMTCT services. According to the United Nations Resident Coordinator Rosa Malango, young people, especially adolescent girls and young women, continue to be infected by HIV, accounting for just over 1/3 of new HIV infections.
Every week, 950 Ugandans acquire HIV. I repeat, every week, 950 Ugandans acquire HIV. This means that in 2017, we were talking about 50,000 Ugandans. And unfortunately, most of them are young girls. I want us to pause and think, what are the implications of these numbers for Uganda that wants to become a middle-income country? What kind of citizens is the country going to have if we don't stop these numbers? These are our doctors and our engineers. These are our members of parliament and our ministers. These are our entrepreneurs and our teachers that right now, at such a young age, are already being infected with HIV.
I now take the honor to
launching the National HIV Prevention Roadmap aimed at ensuring zero new infections by 2030. Minister for Presidency Esther Mbayo observes that little male involvement is hampering efforts to reduce new infections.
But the problem was men. Men don't want to test. But we were just talking. Men don't want to test. What have we done about the men who don't want to test? Let us encourage the men. Let us walk the talk. Let us talk sense. Let us put sense in the men's heads. Except the men who are here.
During the Uganda Country Coordinating Mechanism for Global Fund, the country Global Fund body's recent site visit in eastern Uganda, locals blamed the epidemic to men and partners who don't want to disclose their status.
Omusaada amira idagala nga tayenda akobera mukazi. Era omukazi yena bwabanga yekwese bwekweke yena yalimira nga tayenda akobera musaada naddala abafumba abakabonagana. Aye ngai fotulwiremu eyo omuntu buli muntu ayabaide mwine kyali kale eyo kusaidi yange kizirawo.
Kala akawuka kano kaganye lwakubanga nti abantu balina obutakkiriza nti nakawuka. Kasinga abantu bano bakkiriza ne babulira ne family member. Abantu aba bakkiriza ne babulira ne family member bali bulungi era bamira bulungi eddagala.
Then it must be compulsory in health centers that if somebody enters the health center for any test, they first test for HIV. Let it be a government policy that everybody must be tested.
Like the rest of the world, Uganda is committed to the 2016 political declaration on HIV and AIDS, which aims at reducing new infections and focuses on the global goal of ending AIDS as a public health threat by 2030. Bernard Yiga, UBC TV, in Kampala.